Deputy Speaker, I again rise to speak on the Legal and Social Issues Committee inquiry into increasing the number of registered organ and tissue donors that was tabled in March 2024. In doing so, I acknowledge and commend the Victorian Government for its official response to the report of 4th of December, outlining its support for the report's 41 recommendations. As a result of the committee's good work and, of course, the Victorian Government and the Minister for Health, whom I acknowledge and thank for her work, will now be making it easier for Victorians to register as organ and tissue donors because every registration can help save a life. In Victoria, the number of deceased organ donors and lives saved was the highest in the nation in 2024, reflecting the generosity of Victorians and their families and the dedication of specialist staff who facilitate compassionate conversations to save and transform lives across our community. However, in the past 3 years, the proportion of Victorians registered as donors has decreased, with the state's registration rate on the Australian Organ Donor Registry now lower than the national average, reaffirming the need for urgent action to increase these numbers. It also attests to the efforts of donation specialist staff at the Victorian Health Services engaging with donor families and facilitating compassionate and those meaningful conversations, ultimately driving those successful donation outcomes. However, increasing the number of registered donors has been a challenge since the COVID-19 pandemic, with a downward trend persisting in Victoria and most Australian states and territories over the last 3 years. Without the gift of organ donation, many Australians would simply not get that second chance of life. And the Victorian Government is absolutely committed through its response to this report to improving the healthcare and saving lives through that increased organ and tissue donation registration rates. The Government's response outlines support for 17 of the inquiry's recommendations in full, with a further 24 supported either in principle or in part to boost Victoria's registered donation numbers. And as part of this approach, I'd like to draw the House's attention to a couple of those significant parts of the responses. That the Labor Government will take immediate action to expand donor registration pathways, including updating Victoria's driver's licence system to prompt and direct people to sign up to the Australian Organ Donor Register. We'll be providing links to the registration website. Also will be added across several Service Victoria cards, including for those applying for a digital driver's licence from mid-2026 this year. This is in addition, of course, to the recent launch of a dedicated information page on the Service Victoria app and website to connect users directly to Donate Life's registration website. The Government's committed to boosting community awareness in areas where there are low donor rates and support specialist staff to facilitate those compassionate and culturally appropriate conversations with Victorians. The Government will in principle work to help keep building capacity for Donate Life and the Tissue Bank of Victoria to continually improve the recruitment and retention of organ and tissue donor specialists. The Government supports Victoria's Department of Health and Donate Life Victoria to work with the Organ and Tissue Authority to improve public reporting of donation specialist training, including by publishing jurisdictional level data about attendance and effectiveness of family donation conversation workshops. And the Government will advocate the Australian Government for additional Organ and Tissue Authority funding to increase awareness campaigns about organ tissue donation that use postcode data to target localities with low registration rates and tailor messaging based on that demographic data. The Government said it will support in full and will consult with Support Donate Life, to undertake targeted awareness campaigns about organ and tissue donation using Victorian registration demographic data and public report on that effectiveness of those activities undertaken. And the Government will support and ensure that all avenues it uses to promote organ and tissue donor registration include, where possible, personal stories from donor recipients and donor families, as well as content to dispel myths and misconceptions about donation and encourage people to discuss donation with their family. The Government's response is part of the ongoing work to improve donation and transplantation outcomes, which also includes the Organ and Tissue Authority strategy of 2022 and 2027. And Deputy Speaker, of course, the Government's response also builds in response to the work of the Parliamentary Friends of Transplant Australia's work and advocacy, which has remained committed to supporting and advancing the bipartisan recommendations from this parliamentary inquiry to increase the number of registered donors across respective Victorian communities. In establishing the group, I was very proud to co-found it, of course, with the member for Euroa from the other side. I acknowledge the Minister for Health for her fantastic support of the Parliamentary Friends group as well, the member for St Albans and so many other colleagues who are members of that organ donation group. Transplant Australia, Organ and Tissue Authority representatives, Donate Life, Dr Raj Kilhan, Dr Preti Kilhan, who do magnificent work with our multi-communities, Ayushi Kilhan from Body Buddies too.